1Q21.1 microdeletion syndrome is a rare genetic condition caused by the loss of a small piece of DNA on the long Q arm of chromosome 1. It is characterized by high variability in its expression, ranging from people with no noticeable symptoms to those with developmental delays, intellectual disabilities, psychiatric issues, and physical abnormalities. Most common effects and symptoms. The clinical features are diverse, but the most frequently reported symptoms, 50-75% of cases, include developmental delays, specifically in motor skills, sitting, walking, and language. Mild to moderate intellectual disability occurs in about 25-50% of cases. Dysmorphic facial features. These are usually mild and non-specific, such as a prominent forehead, large rounded nasal tip, long philtrum, and high-arched palate. Microcephaly, an unusually small head size, observed in roughly 39% to 83% of cases. Neurological and behavioral issues. Weak muscle tone, hypotonia, often present in infancy. Seizures, reported in roughly 23% of cases. Neurobehavioral, autism spectrum disorder, ASD, ADHD, anxiety, and sleep disturbances. Schizophrenia. Studies suggest a significantly increased risk for developing schizophrenia in adulthood. Physical anomalies, eye abnormalities, such as strabismus, crossed eyes, cataracts or refractive errors, 26%. Cardiac defects, more common in females. Skeletal malformations, such as joint laxity or scoliosis. Feeding GI issues, poor growth, failure to thrive. Gastroesophageal reflux disease, GERD, and chronic constipation. Treatments and management. There is no cure for the 1Q21.1 deletion, so treatment is symptomatic, supportive, and multidisciplinary. Management typically includes early intervention, early childhood interventions, such as physical, occupational, and speech therapy for developmental delays. Neurological care, evaluation and treatment for seizures, usually with anti-seizure medications. Psychiatric support, behavioral therapy and counseling. For ADHD, autism, or schizophrenia symptoms. Cardiac and specialized care, regular monitoring by a cardiologist for heart defects, ophthalmologist for vision problems, and gastroenterologist for feeding GI issues. Feeding support, nutritional management, or feeding therapy, including G-tube in severe cases for failure to thrive. Inheritance and diagnosis. Diagnosis detected through chromosomal microarray. CMA analysis. Inheritance. Inherited in an autosomal dominant manner. One altered copy is sufficient. However, 18%-35% of cases occur de novo, randomly, while others are inherited from a parent who may have milder symptoms or be asymptomatic. Incomplete penetrance, to which proves that Gypsy Rose Blanchard's operations and treatments were 100% necessary, thus proving her mother, Dee Blanchard, did not suffer from MBP aka Munchausen syndrome by proxy.